Hello, and thank you for joining us today. My name is Lisa Quainu, and I am the new intern with the Equity, Inclusion, and Diversity Committee here at Mayo Clinic's Department of Laboratory Medicine and Pathology. I'm studying global and public health sciences at Cornell University, and I'm here with Jacob, and he will be answering a few questions about his role and experience at Mayo. So, Jacob, could you please introduce yourself?
Yes. Melissa, thank you for having me here. So my name is Jekap Omod, and I work at Mayo Clinic. My current position at Mayo is a clinical lab technologist. So that is what I do right now.
Okay, thank you for introducing yourself. Could you answer, please, what made you choose Mayo Clinic as an employer?
Yeah, well, that's a good question. Uh, First, I would say that, of course, Mayo is, the best hospital in the United States. And I will also say that, it is one of the best hospital in the world. So um, being at Mayo or getting a job at Mayo, I think for me, I would say that it's pretty much a dream come true for me because, um, it is one of the best place to be, I would say by far right now.
That's good to hear. What's your favorite part of your job?
Yes. So what I do in my lab is, as a technologist, we do run samples for the patients. And, here at Mayo, we do put our patient first. So caring for the samples that we do run and taking everything seriously, I think that is one of the things that I've learned so far. And my favorite part of it is that, in our lab, the collaboration and the teamwork, I would say that is by far my favorite thing because, we do get like everyone's back, we do work together. If we got some questions, we do ask one another because we make sure that, we get the best, the most accurate result in our lab before we send it to the providers.
That's really cool. What would you like to tell our audience about Mayo Clinic?
Well, as an employee, I would say that Mayo Clinic is the best place to be, or it's a great environment to be in. From my own experience, that I would say that our lab is by far one of the most diverse lab at Mayo. We do have different people with different backgrounds, different ideas, different ways of approaching problems or resolving issues. So, uh, so yeah, it's a good place to be as an employee, and also it's a great place to be as a patient because they do provide the best uh, care. Um, I mean, that's what I could say. As a patient, Mayo is the best to be.
Yeah,
It's the best place to be. Yes.
yeah. So, since you already brought up patients, could you talk more about how your job makes a difference in patients' lives?
Yes. So our lab, we do run different kind of like testings. We do tests for coagulation, hematology. We do tests for COVID, TGs. We do tests for cardiac, and also chemistry. We do blood gas testing. So we do have a lot of different tests in our lab. So like I said before, the providers do depend on us, and what we do behind the scene. I mean, we are not really walking around, but behind the scene, the results that we get, um, the provider do decide based on that. They do decide based on the results that we send them, and that helps them diagnose, their patients and try to understand what their patient is going through. So yeah, the results that we send to the provider, that helps them decide, what to do with the patient. So that's very important. and that's why we take what we do very seriously, because even if you're making a simple mistakes, that would definitely change, the result, the outcome.
Yeah, it seems like patient outcomes are very dependent on lab results.
Pretty
Can
much, yeah.
you can you share a story that demonstrates how Mayo Clinic provides you with a sense of belonging?
The sense of belonging. Well, beside the science that we do in the lab, and everything that we do, I would say that, by far our community, the community that we built for ourselves, is the best experience that I have so far. Not only do we uh, work together in the lab, but also, outside the lab, we do hang out. As a lab scientist, we go to, you know, to grab breakfast together. We do our potluck together, and like that kind of like community that we build for one another. It just makes me feel like I belong to this place. This is a great place to be.
Yeah, it sounds good. Compared to other jobs you've had, how does Mayo Clinic compare?
Yes, I would say that the first job that I had was a lab research at the University of Minnesota and medical school. In the lab, pretty much what you do is like you pretty much you make a lot of mistakes, and then you change your procedure, you change your approach, you change the way you approach the experiments, and then you just keep going until you get like a good data. But
Mhm.
at Mayo, you're working with human being. You're not working with mice. So you make sure that yeah, you minimize the mistake that you make. As much as possible. Make sure that whatever that you're working on or whatever that you're sending to the provider is the best accurate. Like um, uh, and that's what makes it different. We try our best to minimize the problems or the mistake that we make.
Okay. So for the last question, what do you see as your future at Mayo Clinic?
Well, right now I'm in the process of trying to get to medical school. So my goal is pretty much to work at Mayo, not just as a lab technician or a technologist, but as a physician, because of course, that's where I would want to see myself to be, and that is my goal for the future, to work at Mayo, if not in the OR, maybe with you know, like just. I mean, I love surgery.
Mm.
That's what I want to do, but also, I would work as a physician, like anywhere, any department at Mayo. That's my goal.
That's really cool. I wish you all the success with achieving that goal. Uh,
Thank you.
thank you so much for sharing your experience.